Cognitive behavioral therapy, CBT, is a type of psychotherapeutic treatment that helps people learn how to identify and change destructive or disturbing thought patterns that have a negative influence on behavior and emotions. Cognitive behavioral therapy focuses on changing the automatic negative thoughts that can contribute to and worsen emotional difficulties, depression, and anxiety. These spontaneous negative thoughts have a detrimental influence on mood. Through CBT, these thoughts are identified, challenged, and replaced with more objective, realistic thoughts. Types of cognitive behavioral therapy. CBT encompasses a range of techniques and approaches that address thoughts, emotions, and behaviors. These can range from structured psychotherapies to self-help materials. There are a number of specific types of therapeutic approaches that involve CBT. Cognitive therapy centers on identifying and changing inaccurate or distorted thinking patterns, emotional responses, and behaviors. Dialectical behavior therapy, DBT, addresses thoughts and behaviors while incorporating strategies such as emotional regulation and mindfulness. Multimodal therapy suggests that psychological issues must be treated by addressing 7 different but interconnected modalities, which are behavior, affect, sensation, imagery, cognition, interpersonal factors, and drug-biological considerations. Rational emotive behavior therapy, REBT, involves identifying irrational beliefs, actively challenging these beliefs, and finally learning to recognize and change these thought patterns. While each type of cognitive behavioral therapy takes a different approach, all work to address the underlying thought patterns that contribute to psychological distress. Uses: cognitive behavior therapy can be effectively used as a short-term treatment centered on helping people with a very specific problem and teaching them to focus on present thoughts and beliefs. CBT is used to treat a wide range of conditions including addictions, anger issues, anxiety, bipolar disorder, depression, eating disorders, panic attacks, personality disorders, phobias, problems with stress. Cognitive behavioral therapy is highly goal-oriented and focused, with the therapist taking a very active role. People work with their therapist toward mutually established goals. The process is explained in detail and people are often given homework to complete between sessions. Impact: the underlying concept behind CBT is that thoughts and feelings play a fundamental role in behavior. For example, a person who spends a lot of time thinking about plane crashes, runway accidents, and other air disasters may avoid air travel as a result. The goal of cognitive behavior therapy is to teach people that while they cannot control every aspect of the world around them, they can take control of how they interpret and deal with things in their environment. Cognitive behavior therapy has become increasingly popular in recent years with both mental health consumers and treatment professionals. Some reasons for this include: by becoming aware of the negative and often unrealistic thoughts that dampen their feelings and moods, people are able to start engaging in healthier thinking patterns. CBT can be an effective short-term treatment option. It can help people with certain types of emotional distress that don't require psychotropic medication. It is empirically supported and has been shown to effectively help patients overcome a wide variety of maladaptive behaviors. It is often more affordable than some other types of therapy. Cbt strategies. People often experience thoughts or feelings that reinforce or compound faulty beliefs. Such beliefs can result in problematic behaviors that can affect numerous life areas, including family, romantic relationships, work, and academics. Identify negative thoughts. It is important to learn how thoughts, feelings, and situations can contribute to maladaptive behaviors. The process can be difficult, especially for people who struggle with introspection, but it can ultimately lead to self-discovery and insights that are an essential part of the treatment process. Practice new skills. It is important to start practicing new skills that can then be put into use in real-world situations. For example, a person with a substance use disorder might start practicing new coping skills and rehearsing ways to avoid or deal with social situations that could potentially trigger a relapse. Set goals. Goal setting can be an important step in recovery from mental illness and helping you make changes to improve your health and life. During CBT, a therapist can help with goal-setting skills by teaching you how to identify your goal, distinguish between short and long-term goals, set SMART, specific, measurable, attainable, relevant, time-based goals, and focus on the process as much as the end outcome. Problem solve. Learning problem-solving skills can help you identify and solve problems that arise from life stressor, both big and small, and reduce the negative impact of psychological and physical illness. Problem solving in CBT often involves 5 steps: identifying a problem, generating a list of possible solutions, evaluating the strengths and weaknesses of each possible solution, choosing a solution to implement, and implementing the solution. Self-monitor. Also known as diary work, self-monitoring is an important part of CBT that involves tracking behaviors, symptoms, or experiences over time and sharing them with your therapist. Self-monitoring can help provide your therapist with the information needed to provide the best treatment. For example, for eating disorders, self-monitoring may involve keeping track of eating habits as well as any thoughts or feelings that went along with consuming that meal or snack. Progress gradually. In most cases, CBT is a gradual process that helps a person take incremental steps towards a behavior change. For example, someone with social anxiety might start by simply imagining anxiety-provoking social situations. Next, they might start practicing conversations with friends, family, and acquaintances. By progressively working toward a larger goal, the process seems less daunting and the goals easier to achieve. Potential pitfalls. There are several challenges that people may run into during the course of cognitive behavioral therapy. Change can be difficult. Initially, some patients suggest that while they recognize that certain thoughts are not rational or healthy, simply becoming aware of these thoughts does not make it easy to alter them. CBT is very structured. Cognitive behavioral therapy doesn't tend to focus on underlying unconscious resistances to change as much as other approaches such as psychoanalytic psychotherapy. It is often best suited for clients who are more comfortable with a structured and focused approach in which the therapist often takes an instructional role. People must be willing to change. For cognitive behavioral therapy to be effective, the individual must be ready and willing to spend time and effort analyzing their thoughts and feelings. Such self-analysis and homework can be difficult, but it is a great way to learn more about how internal states impact outward behavior. History. CBT emerged during the 1960s and originated in the work of psychiatrist Aaron Beck, who noted that certain types of thinking contributed to emotional problems. Beck labeled these automatic negative thoughts and developed the process of cognitive therapy. Where earlier behavior therapies had focused almost exclusively on associations, reinforcements, and punishments to modify behavior, the cognitive approach addressed how thoughts and feelings affect behaviors. Since then, CBT has emerged as an effective first-line treatment for a wide range of disorders and conditions. Cognitive behavior therapy can be an effective treatment choice for a range of psychological issues. If you feel that you might benefit from this form of therapy, consult with your physician and check out the directory of certified therapists offered by the National Association of Cognitive Behavioral Therapists to locate a professional in your area. If you enjoyed this video, hit the like button and make sure to subscribe. I really do appreciate your support.